What can I do to increase my success with and without fertility treatment? This is a really common question we often get in the fertility world. Hi, my name is Dr. Manuela Toledo. I'm Medical Director at TasIVF and part of the Obese Health Group. Welcome to Fertile Minds. A lot of patients ask these questions. What can we do to improve our fertility? How can we avoid having something like IVF treatment? Regardless of whether or not you're having IVF treatment or any other fertility treatment, the worst thing you can do is smoke. I know you've heard it all before. I know your neighbour smokes and had 6 children. Some people get away with it, but the reality is most people don't. So please, please do not smoke if you want to have a baby. You wouldn't let your baby smoke, so why would you? Smoking is one of the worst things you can do. It absolutely damages the eggs and the sperm, and the fertilised eggs, the embryos, just don't grow really well in smokers. And we see this time and time again, and all the research backs it up. The second worst thing you can do is be obese. Now, no one chooses to be obese, but if you are overweight, you need to reduce your weight. You don't need to become thin and skinny, but you need to lose 5% of your body weight to really kickstart your metabolism and increase your chance of a healthy pregnancy and a healthy baby. And it's really worth it in the end when you have that healthy baby. So they're probably the two really, really big things: not smoking and not being overweight. The third thing that's really important is to actually do low-level exercise. So ideal for fertility is 30 minutes of moderate exercise 3 times a week. No, you do not need a personal trainer. No, you do not need to subscribe to a gym. You can just walk around the park or the block with your dog or your neighbour's dog if you don't have a dog, 30 minutes 3 times a week. It is incredibly important, again, to kickstart your metabolism. They're probably my top 3. The other things that are important are at least 2 litres of filtered water a day, no more than 2 cups of coffee a day, alcohol, maybe half a glass of wine with a meal on a Friday night if you really have to, but we really can't recommend any alcohol at all once you're pregnant because it does cross the placenta. And again, you wouldn't want to give your baby alcohol, just like you wouldn't want your baby to smoke or be exposed to smoke. So they're the really important things. And I know it sounds really simple, but when you look very, very closely at your lifestyle, most patients do realise that they're not doing those things. And sometimes if you tweak those things, you might get pregnant naturally. And if you don't, you will have definitely a better outcome with fertility treatments. So I hope you take some of that on board, and we'd love it if you would subscribe to our channel, Fertile Minds. See you soon. Bye.